Hi, I'm Paris, and I'm talking to you from Dallas. If you've been following my prostate cancer treatment videos, you'll know that's a good thing, because what I really wanted for my next treatment was proton therapy rather than regular radiation for the prostate cancer. And the fact that I'm in Dallas tells you, yep, they approved it, I'm in. So yay for that. But if 3.5 hours ago you had asked me how I was feeling about it, probably would have a little different opinion. That's when I was having the procedure to put in the fiducial markers, which sounds like a Wall Street thing, but it's very much a Main Street thing. They have these little tiny ceramic or carbon fiber pieces. I'll show you a picture here. You can see they're very tiny, but I can tell you, having just had 3 of these inserted into the prostate, they feel a lot bigger going in. They need them there so when they do the scanning for aligning up the radiation beams, that they can have a very accurate sense of where everything is. So they had to put 3 of them in. It was like a prostate biopsy, but in reverse. The same sort of stuff in the same area with the same ultrasound magic wand up in the behind and them poking into the prostate, but rather than taking samples out, they put these little beads in. One thing I'll say for the prostate biopsy is it's quick. They poke and snip, and they do 12 of them, but it's done. This was only 3, but I swear it felt like it took longer than 12 samples taken by prostate biopsy. This was more a poke and a twist. It's one of those things that you're clenching and you're trying to get away from it with your whole body, which is pretty much how I was. I think the only thing that would have been more embarrassing was if I weren't wearing a mask and they could have seen the expression I must have had on my face. But the nurse who's assisting is holding on, keeping my legs steady. And I asked her afterwards, because I was kind of embarrassed that I squirmed so much. I said, well, how do most people do with that? She said, yeah, nobody likes it. She said the worst is she actually had someone kick her while she was holding the legs. I didn't do that, but oh, my body just could not stop trying to squirm away from what it felt coming in there. Anyway, it's done. In the short term, that's supposed to be the worst of it. I go in again tomorrow where they do a simulation scan. So they're going to put those little beads to use and set things up and do a scan and see where everything lays that they want to zap, the things they don't want to zap that are prostate adjacent. And then I get to go home for 2 weeks while they draw up the whole treatment plan, and then I'll be back for 9 consecutive weeks of 5 days a week having that proton therapy into my prostate. So this place, or one like it, will be my digs for a couple months, and that also will be strange. The last time I lived in a room this small was when I lived in Japan, but there I was always going out, always having people over, and so it didn't seem so lonely. But I don't know anyone in Dallas, but here it's just going to be me and this room. So already on my first day up here, I'm looking for places where I can walk in the morning. There's a creek with a trail along it, and other places I can go to hang out, get out every day and do things. I don't know the neighbors here by sight, but I know the neighbor that's got a dog a couple doors down. I know the neighbor that makes a very delicious smelling dinner. At least last night's when I walked by, it smelled very good. I'll probably have more time to work on videos once I'm here daily, Monday through Friday, but it's a good thing because I'm getting the treatment that I wanted for the cancer. So stay tuned and I'll see you on the next review. Hi, I'm Paris, and I'm on my 3rd week now of receiving Proton Beam Therapy up here away from home in Dallas, and I'll update you on how that's been going in the next video. In this video, I want to finish up talking about my preliminary visit, what they need to do so they can come up with your treatment plan. Now, the last video I did regarding this was day 1, which is where they needed to insert these, they're small, but they feel a lot bigger going in, these little markers into the prostate. They put 3 of them in, and then day 2 is supposed to be a breeze because I'm just going in for a scan, an MRI and CT scan, so they will be able to see those position of the markers, and then they'll be able to develop the whole treatment plan for my 44 visits. Now, just like on day 1, I need to do an enema before going to the appointment, and in this whole process over the past year with the prostate cancer, I've gotten kind of good at doing them. Not a life skill I thought I would develop, but I did the enema. I hadn't eaten anything that day before the appointment, which was, I think, around 1 o'clock in the afternoon. So they want everything out of there, and they then want you to fill up your bladder so that it lifts the prostate into the most isolated position. And this is how you're going to have your treatment done every time you come in. They really want to have the bladder mostly full and that prostate up by itself so they can zap it without zapping any important adjoining organs or tissues. So when I got there, put on the gown, and I brought my water bottle with me, 24 ounces, and they give you 10 to 15 minutes to drink it, and you're supposed to do it. It's timed so that the water will be filling up your bladder right when they take you back, put you on the table, in this case to do the scan, or on my future visits to do the treatments. So I chugged that down and watched the time, and yep, I got it done just in time. And then I waited and waited and waited, and finally someone came into the little room and said, "Oh, sorry, the person in front of you was taking a little longer, and so we'll get you in there soon." And I'm thinking, yeah, I can feel the bladder filling up, so I'm hoping this will be soon. But it wasn't that much later. They said, okay, we're going to do the MRI. So they brought me in, put me on the table, and move a little bit this way, move a little bit that way, and kind of, the main thing is to relax. They said they want you like a wet bag of sand, because they want the most reproducible position for you for when you're having the treatment. Let the legs go limp and the back and so forth. So I stay still. Well, the MRI machine does the thing and the clicking and the sounds, and they've got their scan and it all looks good. The doctor comes down to check, says that's great. Halfway done, great. So go over to the next room, which is where they have the CAT scan machine. And there's a different person running that. It's a woman very nicely, impeccably dressed underneath the white lab coat. The previous person had been sort of more casual, but this looks very formal. And so get up onto the table and again, try to get in the right position and relax, and they adjust me. They start the scan, and then it stops. The door opens from the control room because they aren't in there with you because of the x-rays. And this very nicely dressed woman comes back in and says, "The scans show you have something in your rectum." Okay, I assume it's not the little things they put in the previous day. So she's saying, "Need you to empty your rectum." So I thought, well, that's an interesting way to put it, but I guess she needs me to try to poop. There's something in there. So back over to the bathroom. And by this time, the bladder has filled up considerably more. So I'm holding on to not letting that go, but I've got to relax over here to try to let this go. And so I work at it, and I couldn't feel that I had anything in there. So I gave it a try, but I just couldn't get anything to come out because I didn't feel that there was anything in there. I'd done the enema, not eaten the whole day. It was hard to imagine there was something in there. So after a couple of minutes, I thought, well, this is not happening. I walk back across the hall. I see the nicely dressed woman is in the control room part. So I walk over and say, I wasn't able to get anything out. So she said, okay, hold on. So she picks up the phone to call the doctor to see what he has to say about this. And she says the patient's unable to empty the rectum, but we're seeing a little something on the scan. Okay. She hangs up and she says, doctor says try again. Okay, well, I know my body pretty well, and if I couldn't do it before, I don't think I can do it now, but I didn't seem to have a choice in the matter. I sort of felt like I was being told in potty training, you stay in that room until I see something in the pot. So go back over to the bathroom and okay, I'm gonna redouble my efforts on this, and I'm leaning to the left and leaning to the right and leaning back and leaning forward, and I don't feel there's anything there, and I'm really having to pee. I really feel like I have to pee, and I've got to hold that back. So I gave it a few minutes of the best try I could. Nothing was happening, so okay, what kind of trouble am I in now? So flushed the toilet, washed my hands, went back across the hall, and she said, so you're able to empty the rectum? I said, no, I can't feel anything in there. I can't get anything out. So she said, okay, I'll have to call the doctor. So picks up the phone. Yeah, the patient was unable to finish emptying the rectum. Okay, hangs up the phone. Says, well, we'll have to put a catheter in to drain that out. So, well, if that's what you got to do, that's what you got to do. Really didn't seem like something she wanted to do in her fancy clothes, even if she did have a lab coat over it. But hey, I'm in the gown, whatever's going to work. Back over into the CAT scan room, onto the table, legs up in like the stirrup position of a gynecologist's office. And this happens to people, right? She takes, I'm guessing I didn't watch, but takes the catheter thing and inserts it and finds what she needs to remove, which it turns out was liquid. It was leftover liquid from the enema. So yeah, there wasn't really anything in nothing that I had eaten, but I didn't evacuate all of the liquid from the enema, and so that's what she had to go in and drain out. So okay, she's none too pleased about it. I'm embarrassed about it, but we got that done. So by this time, I'm really having to pee, and I mentioned, I think you're going to see my bladder's really full. I think I may be beyond that. They don't want it too full. They don't want it empty. So you got to be in the right range. I said it may be too full. She said, well, we'll see in the scan. So she puts me back on the table, positioning, adjusting. Okay, and she goes into the control room. The CAT scan machine starts up very quickly. It stops. She comes back in the door. You have gas in the rectum. She said, I'll need you to go to the bathroom and release the gas from your rectum. Well, this isn't sounding good to me because I don't feel it, and I'm still trying not to pee so hard. But I was told to go and do it, so I'm back to the bathroom again, and I'm squatting down and standing up, and I'm bending over and standing up, and I'm doing every which way, picking my feet up off the floor. It's not going to happen. Of course, the only reason there's any gas there is because they had me twice in there trying to push down to evacuate the rectum of some food that wasn't really there. So if there's any gas there, it's because they made me push it in, but it's not coming out. So, dreading this, flush the toilet, wash my hands, go across the hall. And she said, were you able to release the gas from the rectum? I said, no, I couldn't do it. I have to pee so badly. All I can do is just tighten everything down. I can't selectively release sphincters. So she said, all right, I'll call the doctor. Here we go again. At this point, I realize I'm on Deal or No Deal. And the $1 million suitcase is still up there. And Howie Mandel is about to call the banker and see what kind of offer they're going to make me. So she picks up the phone. Patient was unable to release the gas from the rectum. Okay. Except the phone. I want to say, no deal. She says, we'll have to remove that manually. So, okay, at this point, there's no embarrassment left to be felt. Go back to the other room, on the table, legs up in the stirrup position, catheter in, and a little psh of air comes out. Okay, great. I have to pee so bad, I don't care what happens, just get this over with so I can go to the bathroom. So, get into the position and adjust and try to reduplicate and the bag of sand, except I've got to pee so bad. She goes back into the control room. CAT scan stuff starts up, and then it stops again. She comes back in, says, your bladder's too full, and don't I know it? So she gets the cup and marks on it, fortunately way up on the cup. You gotta get rid of this much, but no more, and come right back. Okay, this I can do in the bathroom. So quickly head over there, fill up the cup, and okay, well that line's kind of, I'm going to the top of that line, what's clearly the top of that line, get that much in, dump it, flush the toilet, wash my hands, back across over there. I'm ready. So puts me on the CAT scan machine, adjust, bag of sand. Now I can really bag of sand because I don't have all that tension of having to just not let the pee out. So I'm good. CAT scan machine goes into the control room. CAT scan machine goes and sounds and movement and all that. So she comes back from the control room and says, well, we got good pictures now, so you're all set. And I can't help but wonder, and so I ask, I said, was I an especially difficult patient to get all this stuff done? And she says, oh no, everybody's different, so don't worry about it. Which means, of course, you're such a pain. And here I am the day I wore all my nice clothes to work, and I've got to stick that catheter up there twice. But after I got home, and after we finished eating dinner, I related this story to my family, especially the part about feeling like it was a deal or no deal every time she picked up the phone. Okay. After that, it was 2.5 weeks of waiting, during which time they prepared my treatment plan. Apparently, it's very complex. There's a medical physicist involved. They told me to come back on May 3rd. And in my next video, I'll tell you about Proton Therapy weeks 1, 2, and 3. And I'll see you on the next review. Hi, I'm Paris, and I'm over halfway through my Proton Therapy radiation treatment for prostate cancer. Halfway through means I've finished my first month and I'm going into my second month. And I wanted to tell you what an average day is like receiving proton therapy treatment. Now, it only takes about 40 minutes out of your day, but you do have to prepare for it. Part of the preparation is what you don't do, and that is to eat foods that can cause gas. They don't like it when you go in there with gas. Probably most places don't, but it's especially bad with this because having gas down there near the end can move things around and move things out of position. When they do the initial scans, they're very careful to make sure you don't have any gas, and so they design the whole treatment for your prostate to be in this particular position, and if you've got gas bubbles pushing things around, it throws all that off. My advice is follow the recommendations about staying away from gas-producing foods and drinks, because if you go in there with gas, they're going to go and take it out. So eat what you want for the day after your appointment, but beforehand you do have to watch it. Also the drinks, you don't want to have carbonated drinks, more gas. You also don't want to have caffeinated drinks, at least for a few hours beforehand, because it acts as a diuretic and it's going to make you feel more like you need to pee. And what I'm going to tell you next is what's already going to make you feel like you really need to pee. So, and that is half hour before the appointment, you need to get started on this. 24 ounces of water. Half hour before your appointment time, you start drinking this, and you need to finish the 24 ounces by 15 minutes before your appointment time. So you got 15 minutes to put this away, and then that's usually, since I'm staying relatively close to the Proton Therapy Center, that's about the time I leave and drive over there. And when I get there, everything's fine. And so long as my appointment starts on time and they don't make me wait too long before bringing me back for the treatment, things are okay. But when there's a delay, then the problems begin. That 24 ounces is working its way through your system at the same rate, whether you're able to let any of it out or not. And they will tell you, don't let any of it out. They want to have your bladder mostly full. The reason for that is it holds your prostate in a good position away from other important things down there. And so the protons can zap the prostate without zapping anything too important that's prostate adjacent. So with my mostly full bladder, I arrived there. Since it's COVID times, they have me fill out the little questionnaire. They take my temperature, put on a sticker showing that I've been scanned for the day. And then I grab my badge and scan myself in. That lets the technicians in back know that I am now in the waiting room and ready. This has got everything I need for my visit. I've got my barcode. I've got my amount of cc's that my bladder should be filled to. They're going to check this when I go back to have them check how full my bladder is before the treatment starts. They look at that. And it's got my schedule card, which has my times. They're different every day for when I have my treatment. There are usually about half a dozen people in the waiting room, and the chairs are separated for social distancing. Mostly older people. Well, it's going to be people with cancer, but sadly you do see some young people there. Usually it's a 5 or 10 minute wait before someone will come out to bring me back to start checking the bladder. If it goes much longer than that, then we're like 20 or 30 minutes, which happens on occasion because the schedule gets messed up, technical things happen. But I have been half an hour or more, and at that point, even though you're supposed to wait, because what will happen, they take you back and you go to a little room where they put you on a table and they use an ultrasound wand on the bladder to see how full it is, and they check my numbers on here, and if I'm in this range, then it's good. If it's too much, then you can be happy because they give you a little plastic cup and they mark on it a line that you're supposed to fill it up to, so you can relieve some of that pressure, and that's always nice when that happens. But when it's going on half an hour before I'm going back, I got to make a command decision about relieving some of that pressure myself. And it's hard because I don't bring my own cup to look at how many cc's. I sort of have to do it by how many seconds worth and estimate how full my bladder is still feeling. Now, occasionally I'll go into the waiting room and there'll be a man pacing back and forth. And I know, yeah, his appointment's been delayed and he's doing his best to hang on. One person I saw was pacing and still nobody came out to get anyone. And then they sort of irritatedly went to the back and they went to the restroom. And a couple of minutes later, they came out. Just as they came out, the technician came calling their name to get them. So they went with the technician to the back. And then 2 minutes later, they came back out with a bottle of water to sit in the waiting room, drink that water, fill their bladder back up. I admit to being thrown in the penalty box once myself. but I've got a pretty good handle on it now. One of the things that happens over the first few weeks that makes it difficult is the treatment will irritate the urethra. The urethra runs right through the center of the prostate. So however precise they are at targeting the prostate and not surrounding things, that's right in the middle. So there's really no way they can avoid zapping that. Now, you zap it once, I didn't notice anything after the first day, but you zap it day after day, and it gets irritated. And when it gets irritated, it spasms. And that's not a good feeling. And I found with its increasing propensity to spasm, it makes for a feeling of urgency. Even when you just have to pee a little, it feels like you need to go a lot and you need to go right now. So at the end of some of my treatments, I have flown down the hallway trying to hold it together and get to the restroom so I could empty my bladder. But again, I think I've gotten a little better at balancing out supply and demand. So once they take you back, check your bladder, assuming it's good, or if you have to, fortunately, you get to drain off a little extra. They take you over to a changing room right outside of the treatment room, and you, just from the waist down, have to undress. I've been able to keep my shirt on and my socks, actually, and my Fitbit. They just want, for the prostate, they want the hip area to be clear because they're going to send the protons in from one side and then the other. So once I've undressed waist down, I put on a typical hospital gown, the kind that closes in the back and you tie it around your neck. Then you wait, wearing your gown and holding onto this because they're going to scan this barcode. They do that to double check and make sure that you're the right person receiving the right treatment. In the treatment room, you have to get up. So they have these like a miniature version of the steps that they roll up to airplanes so people can get off the airplanes. They roll one of those up. You step up that. Lie down. At the facility I'm at, they have these a foam section down where your legs go, and your legs slide down into the grooves in the foam and it holds them in a particular place. Now they have markings on me so they can get you in roughly the right position to start with. They've made marks on my hips, the sides of my knees, and my navel. And it's just a marker, and they put a clear sticker over it. So when you lie down and they get the table into position, they put the lights down, and these laser finder lines, red lines, come down across you, and they line you up so that the lines for the legs, the lines for the hips, the line for the navel, you're all lined up correctly because they're trying to duplicate the exact position you were in when they designed your treatment plan, so your prostate will be in the exact right position. Occasionally, I have gotten in the perfect position from the first time, but often they look at it, all right, scooch down a little bit, down towards the feet, or scooch up a little bit towards the head, or lift your hips up and put them back down. Anyway, there's different things to try to get your body in that exact position again. Once they see that, then they leave the room. And a scanning device slides out. Pretty sure it's a digital x-ray machine. So they're taking the x-ray. So now that you're in roughly the right position, they want to look at those 3 little grain of sand size markers that were planted in the prostate, make sure they're lined up. Sometimes after the x-ray scan, they move the table. Usually it's at an angle. So sometimes I've almost felt like I might start sliding, but and then they go again, and usually then there's another x-ray. And then when they say, okay, we're ready, then the x-ray machine slides out of the way, and then it's time for the protons to be delivered. Now, of course, they stay way far away on the other side of a very thick wall when that's happening. And my experience has been, because what have you got to do? You're lying there on your back looking up at the ceiling, listening. There's first a doorbell sound. That's an indicator for them that everyone needs to be out of the room because the proton delivery is going to start. It's like a ding dong. Okay, occasionally you hear someone running away. And then what I hear is it sounds like someone dialing a safe, like the tumblers on a safe. And then there's the sound of exhaling. This is the sound the machine makes. Once that's happened, sometimes right away, sometimes a few seconds later, the protons start coming through. And I wondered why sometimes it's like a 30 seconds I'm lying there, I'm not hearing the protons coming through, because there's a sound for that, I'll tell you in a second. But it was explained to me that they've got 3 treatment rooms all being fed protons by the one cyclotron. So someone else is in the middle of receiving their protons, you gotta wait till they receive theirs. Now when the protons are being delivered, there's sort of a grinding sound that comes from the machine. It's grrr, grrr. And I haven't counted how many times it does it, but it's pretty consistent in it starts out with a longer series of grinds, and then after 30 seconds or so, they start to get a little shorter, and then by about a minute or so, they're fairly short. Grrr, 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 And then there's another breath, and then you know it's done. And then you'll hear the footsteps of the person coming back around the corner, and they say, all right, well, we're half done, because they now need to put the protons in from the other side. Depending on which place you're having this done, you may have the machine rotate around you, or they may take you and rotate you, so now you've got your hip against the proton emitter in the machine. There's the x-ray, maybe you're in the right position, maybe you've got to adjust. Usually by the second one, don't have to adjust anymore. The x-ray machine goes back, the doorbell rings, ding dong, and then the person scurries away, and you're waiting and listening, and you hear the tumbler of the safe, and then the breath of air, and then the grinding, and it gets shorter towards the end, and you come to know that real well, because by the second half of this, you've been on the table for 10, maybe 15 minutes, and the worst, is when they incline the table not only a little to the side, but up, so you're like this, and you've got to pee. They give you a little ring for your hands to hold on to, so your hands can do something, and you don't, I guess, absent-mindedly put them down by your side, because now that's going to be where the proton beam's coming in. You don't want that. So they give you a little ring to hold on to, and when you've really got to go, you're working the ring. So the grinding winds down, and then there's the breath of air, and somebody's coming to relieve me so I can relieve myself. So they come around, they roll the little airport stairs on the way out. They've got the card with the next day's time. That was hard for me at first, because having the least seniority, I got stuck with the worst times, the 5:30 in the afternoon times. They ask you to pick a 2-hour block when you'd like to receive your treatment, and mine, I picked noon to 2 p.m. and it was 5:30. But they've finally, that now have enough seniority, and there are enough newer people in the process that they get the crummy times, so now I usually get the times that I like. So that's a day in the life of receiving proton therapy for prostate cancer. I'll discuss some of the wider scale issues involved once you've had weeks of the proton therapy, including the side effects, and yes, there are some more, maybe milder than regular radiation, but at least in my case, I did not escape the side effects. I'll tell you all about those in a future video, and I'll see you on the next review. Hi, I'm Paris, and while I'm up here in Dallas receiving proton therapy for prostate cancer, I've intended to do some videos explaining about proton therapy, more informational type videos rather than entertainment type videos, and yet every week it seems something happens that just cries out to be told in a story. Last week was no exception. So there's this unfortunate dichotomy that goes on with radiation treatment for prostate cancer. Part of it is you need to drink 24 ounces of water before each treatment. They want to fill your bladder up. That lifts your prostate up and away from other things, so when the radiation's applied, it doesn't harm those other things. That's all good. However, side effect of the radiation, because the urethra travels right through the middle of the prostate, there's no way you can move the prostate away from that. It's going to get zapped, and it really does. And what that causes is a kind of spasmy, unpredictable sense of urgency, like, oh my gosh, I can't hold it, I gotta go right now. Sometimes related to partially full bladder, sometimes just out of nowhere that happens. And as the treatment goes on and they zap it every day, 5 days of the week, week after week, it gets really bad. Now this is just speaking for me. Maybe I'm in the minority, maybe I'm in the majority. I know the people who've written the books talking about how great proton therapy is. They talk about how few, if any, side effects you'll experience. And if I experienced few, if any, side effects, I might have written a book too. But so I don't know whether their view of, oh, it's such a breeze, you take a radiation vacation, go and have your treatment, and then you spend your days doing all these wonderful things. Yeah, for me, they can be wonderful things so long as I'm not too far from the bathroom. In any case, they make you drink 24 ounces of water half hour before your appointment. So by the time they get you on the table and get everything lined up, you've got a full bladder, which is uncomfortable at first, but as time goes on, it gets pretty much unbearable. For me, the first week, I had no side effects from the treatment, but it was that first weekend after a full week of the proton therapy treatment that the spasming started, and it was just out of the blue and just doubled me over, and then it would release and then it'd be okay. And then it got to coordinate itself so that even a partially full bladder would trigger it and send you running for the bathroom, and you think, well, I know I can't possibly have that much in my bladder, but it doesn't listen to reason. It wants to go right now. So I told my radiation oncologist about that, the doctor here at the Proton Center, and he said, well, yeah, some people have that, so I'm going to prescribe Flomax for you, and that will help you to empty the bladder. That really wasn't my problem, but it will also help reduce that sense of urgency, and that's what I really needed. So I was able to pick that up the next time I was back down to Austin, and then I read over the list of possible side effects, including heart rhythm issues and blood pressure issues. And that wasn't a good sign for me because I've already have a health history of heart rhythm issues. So I was nervous taking it the first time, and I also had read that a number of people found if you take it every other day, you can have most of the same effect because it stays in your system quite a while. So I decided, all right, I'll do every other day, but I don't want to push it more than that and trigger something bad happening. I think I started on that my 3rd week of treatment of the 9 weeks of treatment that I have scheduled. And it was good for a week or two, but the taking the Flomax the every other day provided this level of improvement. The problem was there was this cumulative effect of week after week of zapping the urethra, and the spasming got worse so that it was hard for the Flomax to sort of keep it under control. So there were a few dicey moments on the treatment table where they give you this little ring to hold on to keep your hands from going down to your side and getting into where the protons come flying through. And given that ring such a workout, just hold it together a few more seconds. And on this particular day, when they took me back to do the little ultrasound over the bladder to see how full my bladder was, they say, oh, you're still a little too low, so we want you to drink another glass of water, and then we'll give you a couple minutes and it should go through, you should be all good. So I drank another 12 ounces of water on top of the 24 ounces I had, and so they got me back. And I'm struggling already to hold things in. They did the radiation, the protons from the first side, and normally, so long as I'm not killing that ring before they get to the second side, I know I'm going to be okay. But it was just too much. And so at the end of the first dose, when they were coming to swing me around, I said, I'm sorry, I know you've got me all lined up and everything, because you have to be in the exact position, and if you move, then they got to do all the stuff over again. I said, but I don't think I can make it through doing the second half of this without peeing. So I've got the hospital gown on, lying on the table, looking up apologetically, explaining this, and the technician looks to me and says, do you want the clamp? And it was silent in the room. I didn't know, from the sound of that, I didn't not want to go there. And they just looked at me waiting for an answer. And I said, I was hoping I could just go pee a little. And it was silent again. The technician and I looking at each other, me expectantly waiting. And they seemed to consider things and said, on the x-ray scan, we can see that your bladder is still down at the lower end of where it should be for doing this. So he said, I understand the urgency that you're having, so okay. And she gave me one of those plastic juggy things with the handle that you can pee into from being in the lying down position. She said, you can just let out as little as you can to be able to get through the second half of the treatment, and then afterwards I'll tell you about the clamp. So I knew I had gotten myself in trouble with that as I let off 50 cc's of pee. I thought, okay, this will get me through, and handed that over, laid back down. They had to then readjust and scan because I had moved. And while they're doing all that, I'm thinking to myself, oh, I've gone and done it now. Whatever the clamp is, I don't want to know. And I know I don't want the clamp. I'm going to be able to, I'm just got 2-3 weeks left of this. I'm not going to start clamping things now. So after the treatment was finished, and I ran down the hall to the restroom and got rid of the rest of that fluid, 36 ounces of fluid, and changed. She was waiting for me outside the changing room, and when I came out, she said, this is the clamp. And she showed me a device. It's sort of like a splint for your finger. It's got that aluminum shaped thing, but there's this part of it, there's this part of it, and then there's a little bloop, and then also on the bottom there's an obvious indentation in it where something is supposed to go. And it's got some foam inside, but it was together on one side, and it looks like they take it, it's open on this side, and they or you, I don't know, they put it on the base there, and they clamp it shut, and I guess something clicks in place to hold it shut. And with that, there's no way that you have to worry about peeing. There's no way it's going to come out. Now, she said, it's not painful, but it can be very uncomfortable. And I'm thinking, yeah, that's like the dentist who tells you, you're going to feel some pressure. I don't know what look I had on my face, but she looked at me and then said, really, it's not painful. And she put a finger in and kind of closed it part way to show oh my gosh, I'm feeling like I'm 8 years old and I got in trouble. And I know when my father gets home, I'm going to get a spanking. And I'm thinking, how can I get out of this? What can I say so this will not happen? And so fortunately something did come to me. I said, hey, I'm on that, taking that Flomax that's supposed to help with this. I've just been taking it every other day. I said, what if I just start taking it daily? Do you think that might be good enough? We don't have to do this? And this technician said, I can't advise you on that. You'd have to talk to the doctor related to the medicine. I said, well, it's okay. I was prescribed it daily. I just haven't been taking it daily. I said, I'm going to try taking that daily and see if we don't need to use that. The technician said, okay, we'll give that a try, but we always have this just in case. So as soon as I got back to my hotel room, took a dose of the Flomax, okay. The next day I took another dose. I thought, all right, this will take care of it. So that was Thursday and Friday. I was back in Austin. And then Saturday, was not a good day because the heart palpitations and the rhythm problems, they were bad. Blood pressure was up, blood pressure was down. I spent most of the day in bed. This is what I was afraid of. I was going to have this reaction to the Flomax because it's listed as a side effect. It can mess up your heart. And it did. So I didn't take it Saturday. Sunday I was feeling better. And so now the Flomax was going to be my savior and get me through this. Now I'm afraid to take even a single dose of it to go back to the every other day because I don't want to trigger the heart issues, especially when I'm alone up here in Dallas. So I was in a bad way driving up to Dallas on Monday wondering how am I going to get through this, and I decided, okay, we're not doing medications. We're going to talk to ourselves because they said on the scans that the bladder is not that full. It's all in the mind. I'm getting these signals that normally would indicate my bladder is about to burst with fullness, but it's really not. It's only maybe 60% full. So I've got to overcome all the years of my life where that sensation meant I really, really had to go and convince myself, no, that's not really the case. So on Monday, it was time for the Jedi mind tricks, talking to my bladder. These aren't the urinals you're looking for. So I surprisingly got through Monday okay. It was bad, but it wasn't unbearably bad. And so I thought, okay, now if I can succeed one day, I can succeed more than one day. So I've been working on talking myself up to be able to do that. And it's Thursday. I've already finished Thursday's treatment. I think Wednesday was a hard day. Wednesday came close. If I can get through it, if it's not as spasmy. I keep telling myself that and telling my bladder that. So I've got just tomorrow, then one more week to get through. I'm not going to be using the medication. It's all up here. Maybe when I'm home this weekend, I will watch some Star Wars and refresh my technique, and I'll see you on the next review. Hi, I'm Paris, and I am back home in Austin after what seems like a long time away, having Proton Beam Therapy radiation up in Dallas. For 9 weeks, I was up there getting irradiated daily, Monday through Friday. I did come back home on the weekends, and what do I have to show for all my efforts? Well, they gave me a certificate. They do a little ceremony on your last day of treatment and give you this certificate. It's nice. They have everyone in the waiting room. They get their attention and they read this and they have you ring a gong, which is surprisingly loud. I had seen people while I was sitting in the waiting area come out and they say, oh, it's your last day, Mr. Johnson. It was always the men that said, no, would you like to do this little ceremony? That's okay. And they just left. So a number of women did do the ceremony, but I didn't see many guys. But I decided, even though it seems a little corny, yeah, I'll go ahead and do it. So they got everyone's attention, had me stand there in front of everyone and presented me with the certificate. And to my surprise, when they were reading the bottom part of this, it's a little poem. Let your strength and courage be felt by all as this gong's song fills the hall. For every time we hear this note, another life be filled with hope. It still kind of tears me up just about going through it and letting other people know that you made it through, that it can give some hope to them. So yeah, I kind of teared up at the time as well, and took the gong ringer and gave it a good smack, and then left and told everyone there, you know, good luck in your journey. So it was actually a nice kind of thing. Nice as that was, did I come away with anything else after 9 weeks of radiation? Or as people have seemed to want to ask me, are you cured now? Well, it's not that simple to know. This Friday, I'm going back to my medical oncologist here in Austin. It'll be my first blood work done since late April. And so I really don't know what my numbers have been doing. The number in specific is the PSA number. Now, it was around 1 after I finished the chemo, and it seemed to be steady there, which is good. 1 is low. A PSA of 1 is a good number for a young, healthy man with no cancer. So that's a good number to have, I feel. And I'll find out what my PSA is doing. Now, if it stays at 1, it's good. Does that mean all done with cancer? No, you can't be sure of that, because I'm also on a hormone suppressing drug, testosterone suppressing. It's called Lupron, and Lupron on its own can keep your PSA numbers way down. Now I thought I would be on Lupron for at least a year, maybe 2, but the doctor up in Dallas, the radiation oncologist, said he would recommend 3 years. 3 years of no testosterone. But anyway, that's its own issue. But how does that tie into all this? Well, that can be keeping, in other words, it can inhibit the cancer. So the cancer just sort of goes into hibernation mode because it doesn't have the testosterone to work with. But when the testosterone comes back, so can the cancer. Well, actually, the cancer never really left, but it can start to grow again. So you can't know for sure until you're off of that Lupron hormone suppressing drug and give it 6 months or so. And then if your PSA numbers stay about the same, or they're actually allowed to go up a little when you go off it, but level off and stay the same, then you're probably in good shape. So we're looking years in the future to know that. So really the only news I could get on Friday would be bad news, which is if my number has gone up in spite of the radiation and in spite of the Lupron, then that would be a bad sign. So the best news I could get on Friday is nothing's changed. And it's been almost 4 weeks now since my last radiation treatment day, and the side effects, they're still experiencing them. They have all improved, and I'm hoping they will continue to improve. But if you watched my previous videos on the subject, there's the spasming bladder and urethra, and what they call urinary urgency, which got really bad towards the end of the treatment, but it has definitely improved. It still lets me know when it's unhappy, and hey, you better get to the toilet now, but I can tell it, no, it's not convenient, we'll do that a little bit later. And so far, I've been winning that battle. It's actually gotten easier to win the battle because it seems to be less and less irritated and sensitive. So that's improving. Hope that will continue to improve. Conversely, or should I say on the flip side, about the radiation that gets to the rectum and triggers fecal urgency, that's also having irritation, but in the rectum, so that if anything at all seems to accumulate in there, it wants to get it out now. So that has improved a great deal also. Will things go completely back to how they were before? That I don't know, but it's improved enough now that I could live with it if it stayed like it is now, but I'm hoping for some continued improvement. And for the chemo, which I finished, it's July now, finished the chemo back in February. With 5 months to recover, you would think surely you're past all the chemo side effects. No, on average it takes 9 months to completely recover from chemo. The other main side effect is the radiation fatigue, and that took a couple weeks of being back home before that actually started to improve. The radiation that you're dosed with every day does damage the cancer cells, but it also damages healthy cells, and your body gets in there and starts repairing them. But then the next day, here comes another dose, and there's more cells damaged, and day after day, your body ends up falling behind and actually expending a lot of energy trying to repair the damage being done. I got so that I really couldn't get through a day without having to go to bed for a while and take a nap. The energy was just gone. And so every afternoon there was a nap, and that continued after I got back here for a couple weeks, even though I had so many more things I was trying to catch up on and do while I was here. But finally, after about a couple weeks, I made it through the day without a nap, though it was tough, and it's gotten easier and easier. And I still feel like nap would be nice, but now I can get through the whole day without having to do that. And every day I walk. I tried to do that through all my different treatments. Back before everything started, when I was thinking I was going to have surgery, I was working to walk further every single day to build up myself into the best shape to get through the surgery, because I knew I wasn't going to be walking anywhere for a while. And I could do, in the morning, I would do about a 5-mile trail walk, which included a couple hundred feet of elevation change. And so that was my peak, that was my high point. And my lowest point, some days on chemo, the worst days after the infusions, I could hardly get out of the house. When I would go out and walk with the kids, a half-mile would just wipe me out. Anyway, with radiation, while I was up in Dallas, I would walk every morning around the neighborhood, and I tried to get in at least 1.5 miles, but with the fatigue, that got to be a little hard towards the end there. But it's improving. I'm back up now to 3.5 miles on my morning walk. So where do I go from here? Well, hopefully no more intensive treatment. I do have to stay on the Lupron, which I really dislike. Having no testosterone affects you in ways, well, there are ways you would expect, but there are ways that you wouldn't expect as well, including the fact that I'm still anemic because the lack of the testosterone's involved in keeping your iron and red blood cell levels good, and without the testosterone tends to drop down. So I'm no longer moderately anemic. I got pretty low while I was doing the chemo, but once I got off the chemo, I expected to be all the way back up to normal. No, I still have mild anemia. But for the next couple years, my cancer treatment will consist of keeping my testosterone levels down near zero, and for my part, continuing to eat a very nutritious, plant-based, whole foods diet and getting in lots of exercise every day. I know that the treatments that I had got rid of most of the cancer. I could see that in the MRI that I had after the chemo, that they couldn't see any more of it outside of the prostate, and even in the prostate they couldn't really tell, is there any cancer in there? So that's all good signs. It was beat back significantly, but it only takes a little bit remaining to start growing all over again. So I am dedicated to making my body an inhospitable place for cancer to grow. Lots of those plant-based foods are high in fiber, which helps out my microbiome, and I'm making a point of eating lots of fermented foods as well to also help the microbiome. You got a happy microbiome, it produces these short-chain fatty acids, which really are good for your immune system. So in addition to making the rest of my body a place cancer doesn't want to grow, I'm pumping up as much as I can, naturally, my immune system, so it'll be on the lookout for anything that shouldn't be there. Thanks again to everyone for your support and good wishes. I really did take those to heart. And though I still have a few more cancer-related videos I'd like to do. For example, one is, how much does chemo cost? I'll show you my medical bills so you can see. Thank goodness for medical insurance, and I feel so bad for people who don't have that. Also, what is a cancer survivor? I have some opinions on that now, having been through this over the past year, so I'll be doing a video about that. So I'll take my certificate and pack it into a bin with my binders related to cancer, the books, the notebooks, the journal, the test results, the billing, all of that stuff. I'll pack into a bin, and hopefully in time that bin in the back of the closet will have more bins stacked on top of it, and clothes and other closet stuff, and it can be almost, but not completely, forgotten. And I'll be seeing you on the next review.
There are so many choices and you don't want to stress. You want your health food at home, receiving only the best. That's what we're here for, we give honest reviews. parristx.